And in this, maybe this video affects you. Watch fully and drop your comments. Let's see. Hopefully, you'll enjoy the process. Hi all, welcome. Hope this video changes something from your. Today we are going to discuss about the manual therapy. In our clinic experience, actually in past 3 years, I hope everyone knows, so we don't follow any passive options mostly to the patients, and never use the modalities, brain healing, cupping, tapings in our clinical practice so far. In Stata, we practice manual therapy also in our early career. We are a team always like to grow and keep on learn and try something new. In the process of learning something past 1 year consistently, we started reducing the manual therapy practice slowly, and nowadays we can, without manual therapy itself, we can able to treat the patients very well. Manual therapy means, what we are trying to say here is doing something passively to the patients. In a sense, so we are all going to discuss something about the manual therapy. I will be a neutral guy. I've tried to be a neutral guy. They are going to say something about the manual therapy in their past experience, what they learned, how when implementing the patients, what are all the problems, or what are all the positive, negativity they faced, when we can apply manual therapy, when we can't apply manual therapy, what are the flaws, and critique. Basically, we are going to critique manual therapy as much as possible. So we are going to start. So
a few minutes later.
Basically, I think manual therapy is just that increase the blood supply to the particular area. You may touch and do it. It just shows the erythromal changes. That's it. I think it's nothing more.
So it's
than
nothing. No, doesn't do deeply anything.
Yeah, I feel like
Okay,
that.
no physiological changes.
Yeah.
Why? How you say this, Ramya?
Because in clinical practice, when I do a release or do any manipulation, try to do it, it's just, I don't think so the pressure is going so deep to the bone or something. It's just a very
So
superficial
you feel
thing.
it's very
Yeah.
difficult to apply that much pressure to release
Yeah,
something.
of course. It's just a superficial treatment what we give.
Yeah, like to apply pressure to remove like knots and all in the muscle, we need to apply a lot of pressure and force to it.
Okay.
So the pressure applied during manual therapy is not so adequate to not so adequate, like it is not that much force which we apply during a manual therapy. So what the changes occur there will be superficial, more superficial. The manual therapy, usually the releasing techniques are set to increase the blood flow to the muscle or the tissue around. So while applying manual therapy, it is not actually doing blood supply increasing to the muscles and all. It just increases the blood supply to the skin alone. That's why we see the erythemal
Skin alone. Fine.
For this trigger release and muscle release techniques, here it's not varies among the individual patients also. It varies among the individual therapists also. What I
Exactly.
apply and feel it as a knot may not be felt by the same therapist and other therapist.
Exactly. Highly subjective in nature.
Yes. It depends, and if and it is also, if you're not finding it as a knot, it is termed as not the proper therapist here.
Okay.
That is another,
So you are palpating something, you have to find out the knot.
Yes.
So therapist goes in that mindset only, something will be problem here. So we are biased at the time.
Yes, if you're not finding out the knot, I mean, you're not experienced as that.
Okay. So the finding the knot determines your experience. So your experienced therapist, you will find out different sides knots. You are not experienced therapist, so you are not.
They say in soft tissue manipulation, they increase the blood flow. First, why you need to increase the blood flow? Because did you find there is less blood supply to that part?
Exactly.
Nothing like that, right? Then why you need to increase the blood?
By moving itself, we can increase the blood supply to the area.
Moving exercise produces heat, so automatically blood flow will increase.
Rather exercise we can call movement.
So in manual therapy, so therapeutic approach, that is passively we joint manipulation, massage, we more focusing on treatment part. So what I learned from lot of while seeing lot of videos, not practicing the assessment part. They lacking, I think, even though they're famous in massage or manipulation, joint manipulation, whatever it is. In assessment part, everyone is lacking. Even though UG and PGP study, so that time also the assessment part is made less in that. So some patients, some therapists may be palpating. While palpating, they palpating the skin. So sometimes they fix the okay, this is the condition. Sometimes some therapists, while observing, okay, this is something the imposture. So asymmetrical imposture. So you have to correct it. So while observing and palpation, so this is the basic assessment part is here. So not much.
So not much into assessing the
Yes,
patient
assessing the
actually.
patient.
And I also
We
feel-
concentrating on the treatment aspect.
Treatment.
Yes.
Manual therapy means only
Correct.
treatment. What is going to assess?
Yes.
What you're going to assess is the biggest thing. People will say palpation. I'm going to palpate this muscle.
Yes.
Again, what you're going to palpate?
Yes.
What you're going to learn? Your palpation and other person
While
palpation is
palpating
highly
is,
different.
yes.
How much
While-
pressure should apply?
Yes.
And that is not measurable. That's what she's.
Yeah, that's not measurable.
We can't
Measurable.
measure the pressure what you're giving.
Exactly.
We can't see how much it's moving on manipulation. So these are not measurable.
Basically,
things.
qualitative.
Yes.
Not quantitative
Yes.
to measure something. It's a visual or observational or seeing things. So it will vary highly person to person. Okay, we are naming that is with experience.
And also, one thing I want to add on is the clinician or the therapist who is doing even the assessment part also, even they intend to do an assessment, they'll be pre-biased. Like, okay, I have this patient, he has something wrong with him, so I have to find something dysfunctional or
Pre-biased.
Yeah, pre-biased. Even
Okay.
before analyzing the patient, assessing the patient, they have to feel like I have to find something wrong, abnormal, or dysfunctional in this patient. So they'll try to, because they have the feel that there should be something abnormal or dysfunctional in that person. So they'll try to find out something to make up for that.
Exactly. I will say this to everyone. So many people in this world have abnormalities. If you go back on the road, see so many people have flat feet, anterior shoulder alignment. So many people. Not everyone complains of pain. At the person come with complaints of pain, immediately you're blaming the posture. How can be? How can it will be? Because the same person lead a life, entire life without pain. Same posture only he was maintained, but immediately how this posture causes pain? What other factors you assess with the help of manual therapy comes into play? What other learnings you people have can also share?
And the role of physiotherapist, usually we say like making the person independent.
Yeah.
Yes, but if a person came with a complaint of any pain, we'll do manual therapy. That means we are doing passive treatment. We are not making the person active at the
Okay.
end of the session. And again, if the person came with the same complaint, again the person depend on the physiotherapist.
Okay.
Again and again,
Okay.
but we are not making the person independent. Instead, we are making them to depend on the other therapist.
So people watching this may have doubt, right? So how to apply manual therapy then? The full session manual therapy is wrong, or how can I plan the session? So if the patient have pain, how can I start a movement? That maybe they will ask. No, what was your answer for that?
There are lots of other options also there, not only a passive. If you want to improve the range of motion mobility, instead we are going for any massage or trigger release. Like that we can go with the stretching or any mobility exercises. Or else joint mobility exercise, lots of exercises there. So like that we can go, so patient also get confidence.
What if the person giving some exercise also has some pain? Did you prefer manual therapy, or at the time also you what you do at the time?
No, because in assessment you would have missed some part. So doing active movements and seeing the assessment, that is much more important.
Oh, okay. So you
Assessment
are
itself
saying
should be in
that
an active
assessment
way.
should be in an active way.
Yeah, that's
Assessment
why-
is not only observing the
Yes,
posture and
exactly.
blaming something,
Exactly.
shift something kind
Yes.
of, and palpating. Assessment also, when you move the person only, you will get some
Yeah.
information. So
I
every
think
session is
that-
assessment.
Yeah, so that you will get the answer so that you can work on that movement.
Okay.
And I think it's not more comfortable for the therapist to give the manual therapy for many patients. Like
Okay.
it's not comfortable for the therapist. The therapist will still get the pain when they will start doing it. So we
Okay.
can't give that much pressure to all the 10 patients you see in a day. So that's not possible, right? So it's not comfortable for the patient also. It's not comfortable for the therapist in giving such pressure.
So what is manual therapy then, according to you? What is manual therapy?
A few moments later.
இல்ல சொல்லுங்க அப்படி.
6.5 hours later.
Someone is doing something on you.
Okay, someone is doing something on you.
Or else
So you depend on some person. Someone is doing something on you, called as a manual therapy.
Yeah. Or else something is doing something on you, like modalities.
Modalities,
Yeah,
okay,
like modalities.
okay,
So
okay,
something
okay.
is doing something on.
Which means some IASTM tool
Yeah.
that spoon massage can. Okay, fine.
And we can that something is not attained by you actually actively.
Okay,
So
you're
only
not did by yourself something.
Yes.
Okay, so in consideration of this, so I'm going to give one person extenotator strengthening by manually applying manual pressure. So it comes under what? Manual therapy. Someone is doing something on you, right? Is it comes under manual therapy or what?
But the patient is attaining actively, right? You're just the resistance is you're giving.
Okay,
Yeah,
okay. So that's an active movement.
active
That's the
movement.
resistive force applied by
Yeah,
therapist.
yeah.
This is also improve the
Yeah, that is
touch
manual
sensation.
part.
So you are a clinician is looking for touch is very important to the patient. How can I implement this treatment without manual therapy and everything? Doing exercise on touching the patient and correcting movement itself can consider as a giving resistance itself consider as a manual therapy. So here what you people trying to say? What is manual therapy? Which kind of manual therapy you people practice then? Which kind of manual therapy you people doesn't practice?
So manual therapy is basically the patient belief is most importantly. The manual while
Okay.
we are trying to give anything while touching hands-on treatment. The patients the day 1, day 2, day 3, they're getting slowly get attached to us and slowly believe on us. So instead of that, we trying to do more education about the condition and trying to do more communication. The communication most important part. So day 1 and day 2, just
So just
educate the
sorry to
patient.
stop you. What is patient education means? What you're trying to say here? What is patient education?
So maybe people come to us with pain. So maybe we all know that the pain is psychosocial factor also is involved. So if it is a psychosocially the patient is involved. What is basically the psychosocial involvement means? So the past experience, how many clinic they visited.
Okay.
So the before how many people they influenced them.
Okay,
So
doctors,
according to the
therapists
condition,
visited,
yes.
each and everyone says
Yes.
something differently.
Yes.
That is affect them. They
Yes.
believe something wrong in their body.
Yes.
Okay.
So you have
I
to
want
educate them.
So how to educate? Some patient come with I have anterior pelvic tilt, I have pelvic alignment. That's why I have back pain. My quadratus lumbar was overloaded. They released. I was feeling better one day. Again, a recurrent back pain was there. Something wrong in my quadratus lumbar. How you educate the patient now?
Yeah, I would like to answer this. Like whenever a patient goes to a clinician or a therapist, they are giving them the medical terms, which
Okay.
they consider it like, okay, I'm giving education about the condition to the patient, but actually they are making them scary. Like they are giving medical terms which are very scary to the patient, and they feel like, okay, something is really very dysfunctional in me,
Okay.
and something is abnormal in me, and that is causing my pain, and I am broken. So that is what the patient gets the idea into his the patient education. What the therapist is feeling like, I have to give information about the condition to the patient. This is not. Actually, the patient education should not be scary to the patient. It should actually educate and give confidence and reassurance that everything is okay and you're gonna be okay and you will get relief of this pain. That is what the patient needs actually.
So here I have to ask you, what if the condition doesn't permit to say this to the patients? For example, consider ankylosing spondylitis. We know that is irreversible condition. It will take a long time. Then how you educate the patient at the time?
So actually, as you asked about ankylosing spondylitis, we have seen a quite number of patients. But here it doesn't apply that only manual therapy. With manual therapy, you can push the patient to the next level. Here we can even start the basic patient education, that we have to address him that this is going to be for you for lifelong. But how can you modify and how can you live freely in a functionally in a very good way, that you are not affected with this condition, and you are like mentally you have to give him a lot of strength. So that
Okay.
here it
So you will explain to the patient. It will take last longer. So you may reduce the session as less as possible. Make the person lifestyle changes and something.
Yes, lifestyle
That's what you're
changes
trying to
plays a
say.
major role.
So if another person come, which I say the quadratus lumborum, that believe already visited 3 people. At the time, how you educate?
Because the normal person, how they know there is a muscle called quadratus lumborum?
Okay.
The thing is, that is from the words of a therapist or a doctor, and that leads to the next level where they Google it.
Okay.
They
okay,
keep on
great.
searching it. They say where it is and how the pain will be. It's a very deep muscle. where it can never be palpated also.
So another doctor add into that, the Google doctor.
Yeah. So that leads to more fear, and that is where the patient education plays a role. We have to explain, no, that
No,
cannot-
what I'm asking, education plays role. How you educate? How to make them understand?
like we can say like okay, quadratic number, there is a muscle,
Okay.
but that is not what is given in the net or what the others say, that is not for everyone. In the population, the 10% may have, or 2% of people may have the problem because of that, not everyone. That we will just
So
say
very
them.
less number of population.
Yeah,
we have.
that-
So we
that-
again listen to them with the history
Yeah.
and everything. We will educate again.
And assess real, and not this is the reason, we will find the real reason, make them move. That will gain confidence, so they'll come out of it.
Okay.
We should make sure that, for example, quadratus lumborum, they are blaming quadratus lumborum. We should make sure and make them understand that it might be due to less hip mobility.
Exactly.
It-
So this will come proper way of assessing the
Assessing.
patient. Great.
If we need to address something, it should be something of measurable. We cannot measure trigger points or something like that.
Exactly, as we discussed before.
yeah.
Correct.
So we need to educate them in such a way, see that
Measurable way. So
measurable way.
example, we can say just do overhead squat. See, you can't even go deeper. That we can educate.
Yeah,
So right
exactly.
and left mobility you can compare and educate. This may be potential contributing factor for this. We can educate. So measure in front of their eyes, show something and change in a positive way.
Yeah, in a positive way. Instead of making them feel broken, as a physiotherapist, we should make them, not break them.
Not break them. Great. Superb.
I feel like if a person came with a complaints of any pain or dysfunction, the main role of a physiotherapist to making them independent, and you have to treat the cause. But if we treat with the manual therapy, we usually treat the symptoms alone. For example, trigger release. You find the trigger.
Okay.
And if you release the trigger, the pain will gone. But we didn't treat the reason for getting the trigger. We are just simply releasing the trigger and all. And there is a controversy still. Trigger point is there or not. We don't know. But we are using the term trigger and we are releasing the trigger. But we are not treating the cause why the trigger was occurred.
Now here the problem is they are find outing that root cause is actually trigger.
Yeah, yes.
The root, we are believing that the root cause is actual trigger. So that we are treating the root cause to eliminate the problem. So what you do this time? How you want to educate the audience?
So here I would like to add on a points like before treating or making. So before making the patient understand that they have disbelief about a condition like the trigger point and all, we have to educate the therapist about it. Because therapists are actually made to believe that actually something is wrong there and we should find something abnormal in the patient. But it is not essentially there.
Okay.
The condition you are looking for might not be there. That is like when you are learning trigger point. So when you go and practice the next day, you will be forced or your mind is pre-fed to find a trigger point in any
Exactly.
patient you find
Exactly.
this. So that should not be there. So
Exactly.
So therapy
Perfect.
should be changed.
So if a person doesn't have a pain in their body also, if you palpate full body, you will find many points have a pain.
Yes.
Do you treat the person?
No.
At the time? No.
So
You can continue. Ayyo.
we see a patient. We have actually seen a patient where we have seen like they have a left side superficial line involvement. But when I was treating, this actually happened. When I was treating, the same pressure when I applied to the right side, even the patient was having the same pressure. But here, how can we conclude that this left
Exactly.
side is involved,
Superficial
right
line
side is
involved.
not
Exactly. Exactly.
involved? So it doesn't have something like you don't have to conclude that this is the patient with the myofascial pain
Exactly.
involvement.
Okay.
So we cannot
Yeah.
conclude it with just the manual therapy.
Yeah, patients who are come, they will complain, I have pain, I couldn't able to move, or else I couldn't able to move because of pain. So movement is the culprit, means movements are produced by muscles. Did you check the muscles? Active way. An active way. Did you actually strengthen, not MMT, I'm talking about not MMT. Please. Any other muscle strength test? Anything you did to assess?
Actually, why I feel manual therapy, dry needling, cupping, and all comes into play is every therapist think pain reduction is the basic outcome.
Okay.
Pain reduction is not only the basic outcome. We should educate the patient
Exactly.
and make them pain resilient.
Okay.
They should adapt to it and they should improve their functional activities and overall physical
Exactly.
activities.
Physiotherapy, we are not studied only to treat pain.
So improve the goal also.
Exactly. Improve the lifestyle and goals plays major role.
and also cost effective treatment.
Cost effective treatment, just say.